use of non-medical masks or face coverings is recommended as an added layer of protection.
In situations where you cannot physically distance to 2 meters, people are encouraged to wear masks.
If 2 people are wearing masks, I'm protecting you and you're protecting me.
When possible, we highly recommend that people wear a mask.
I think adding on this layer as we learn more was the appropriate thing to do.
Hi, and welcome to Power in Politics. I'm Vashi Kapelos. It's now recommended Canadians wear a non-medical mask or face covering when physical distancing isn't possible. That's a change from what Canada's public health officials said at the onset of this pandemic. Here's how that position has evolved. On January 30th, Chief Public Health Officer Dr. Theresa Tam said wearing a mask could give people a false sense of security, which leads to face touching. 2 months later, after the pandemic was declared, Dr. Tam assured the public there is no need to use a mask for well people or healthy people. By April 6th, things had changed, though. The Public Health Agency updated its guidelines to say masks can be an additional measure taken to protect others around you, even if you have no symptoms. That was based on emerging information from the medical and scientific community. Now, officials have gone a step further, saying masks are recommended as an added layer of protection when physical distancing is difficult to maintain, but they stop short of mandating masks in public. So should this advice have come sooner? Melanie Joly is the Minister of Economic Development and Official Languages. She joins us now from the House of Commons. Hi, Minister. Good to see you again.
Good to see you, Vashi.
I have a lot of questions about the LEAF program, the program from the government about lending money to big companies, as well as the commercial rent program. But first, I do want to ask you about the significant announcement from public health officials. Why did this not come sooner?
Well, as a government, we're following the advice of our public health officials, and we work with Dr. Tam. I think this situation has been evolving, as Canadians know, and we're still discovering how the virus is organizing itself, how the contamination is happening. So science is evolving as obviously more research is being done. And I think that obviously coming from a city where there's certainly a hotspot, which is Montreal, and seeing what Premier Legault has said, also, I think that it's just careful right now to make sure that we wear one.
I take your point on listening to the advice of public health officials, and I don't mean to cast any doubt on the advice that they're giving or the intent of the advice that they are giving to the government. But is there a role for the government to ask questions about it? And I'm asking that because I looked, for example, at other countries where wearing a mask, a face mask, is mandatory. There's 50 of them, and they started as early as March. The Czech Republic was making it mandatory back in March. And at that time, we were still hearing it's not going to make a difference. And now we're hearing it is going to make a difference. Do you understand how the public is maybe a bit confused by the advice from the public health officials, but through your government? And should your government be perhaps more skeptical, or not skeptical, but critical of that advice?
I think we're laser focused on following the science, and the scientific community has been evolving in its own advice here, but also in many countries across Asia, across Europe. But at the end of the day, Vashi, people need to be washing their hands. They need to make sure that they're following the physical distancing measures, and we need to flatten the curve. I think the basics of what was told by the public health officials at the beginning, at the outset of this pandemic, are still extremely important and need to be followed, and I think Canadians understand that.
At what point does your government decide whether this becomes mandatory? And again, 50 other countries have made it mandatory. Do you wait for Dr. Tam, for example, to say now is the time to make it mandatory? And what are the conditions for that?
Well, I think that the most important thing right now is to make sure that we have enough testing, that we do tracing, that people follow the public health authorities' advice in terms of washing their hands, physical distancing, that we work with provinces and territories as they are the ones administrating our different healthcare systems, and that we can follow exactly where the pandemic is happening, including in long-term care facilities. And that's what we've been doing as a government every single day.
I understand that. I guess the advice, though, coming from municipal authorities or public health authorities versus provincial authorities versus the health authorities on something like the masks, it's confusing, right? So you hear it's gone from suggested to recommended. Will it become mandatory?
Well, we will always follow the advice of our public health officials, and they're saying that people should be doing that. And so in that context, we'll make sure that we entice Canadians. But we have to remember also that this pandemic is not affecting Canada from coast to coast in the same way. And there are more cases in certain parts of the country, and certainly where the pandemic is hitting in Toronto, in Montreal, well, this is certainly good advice to follow.
Okay, let me turn to the LEAF program. And for our viewers, that is the program that the government has set up. The application's open today for bridge loans for bigger companies. One of the things that the Finance Minister, Minister Morneau, talked about this morning was that a company has to commit to minimize the loss of employment or to preserve employment.
Yeah.
That's a condition of the loan. What exactly does that mean? Does that mean that they can't lay off anyone if they receive government money?
Well, the idea is to make sure that we support businesses that were viable before COVID-19 and that are hard hit by the economic crisis that is created because of the pandemic and social distancing measures. And we need to make sure that we are doing that and using taxpayers' money, let's be frank, to support jobs. And so that's why we want to make sure that there is clear commitments on the part of the companies, but also that there are clear commitments on the part of executives in terms of also limiting their own executive compensation. And at the end of the day, that there's more equity within, our approach.
I just want to know exactly, though, specifically what that means. So the company has to agree to preserve employment. Does that mean they cannot lay off anyone as long as they are in receipt of this money?
Well, the idea is to make sure that we have good conversations with company, that we can provide and protect as many jobs as possible. And while we are trying to have a standardized approach to have more coherence and fairness, at the same time, what we need to do is also to be, doing an approach that is per company.
Protect as many jobs as possible is not the same, though, as making sure Canadians don't lose their jobs. And I tell you why I'm asking. Your government and governments before it, to be fair, have made loans to a company, for example, like Bombardier. Years later, we see executive bonuses that are under the spotlight. We see also many Canadians lose their jobs through layoffs. Is there anything in the agreements that your government will be signing that explicitly prevents that from happening in the future?
Well, Vashi, we're doing that exactly to support jobs and to protect them. Right now, many big companies are the biggest employers in Canada, and they're in survival mode. They were, in good standing positions before this pandemic, and they need to be, helped to bridge their financing to make sure that they can survive. And we need to make sure that while they do that, they protect as many jobs as possible, and that's exactly the intent of our approach. And at the same time, we need to protect pensions. We need to make sure that we protect employees, and that's why it's part of the conditions also of this new financing.
CEOs of companies that, again, are in receipt of government money through this loan program, will they be allowed to take any bonuses?
The idea is that their compensation is limited to $1 million, that there is no potential buyback of shares, and also that they need to show transparency, because as we are looking at in helping companies go through this, we want to make sure that there's good governance.
So executive compensation is limited to $1 million, but say they make $400,000 a year and they get a bonus of $250,000. That's still okay. They can use some of that loan money as a bonus?
We need to make sure that there's fairness, and we need to make sure that there's no unequal treatment, and so we'll be coherent and we'll make sure that the compensation is limited.
With respect, that didn't answer the question. As long as their overall compensation is under $1 million, CEOs of companies that receive government money can still use that money for bonus structures.
The idea is and people watching us will understand, we don't want people to benefit, in an unequal manner. From this. The idea is to make sure that we're financing through loans businesses that are having issues going through the pandemic, and therefore it is not up to executives to profit from it. The idea is to make sure that they can help their businesses survive, and then finally that we go back in a growth period.
But they can profit as long as they profit under the ceiling of $1 million.
We'll go case by case on a case-by-case basis, because, like I said, the idea is that there's no remuneration that is not in line with what was done before within the company.
I just want to make sure that I'm clear, though, on this, because I understand what you're saying, and you keep saying the idea of it is, but in practical terms, is there any limitation to the idea that a CEO can take a bonus, or that this company can lay off Canadians? It sounds to me like there might be some rules applied, but there's no guarantee of either.
Well, because, we'll go case by case basis. We'll see which companies are coming up and how the executive compensation is developed. So that's what we'll do. Meanwhile, we know that we have to limit executive compensation, and trust me, in these big companies, usually the remuneration is higher than $1 million. So in that context, we wanted to really make sure that there would be guidelines and more fairness within the system.
Yeah, I understand in that context, Minister, but I guess for a lot of Canadians who are sitting home without jobs right now, $1 million sounds like a lot. And if some of that money is in bonuses provided through government money, essentially, even if it's a loan, that probably won't sit well.
Well, and I hear what Canadians' concerns are, and I agree with them. And that's why, for the first time, we're trying to limit, executive compensation in the context of supporting our businesses. And that's exactly why we put that as a criteria in the context of this new help. This was not done before, and we heard Canadians, and that's why we're acting.
Okay, Minister, I'll leave it there. Thank you for your time this evening.
It's a pleasure. Thank you, Vashi.
Canada's Chief Public Health Officer issued new guidance today on masks. Dr. Theresa Tam now says Canadians should wear a mask as a, quote, added layer of protection whenever physical distancing is possible. Now, that's a different stance than previous guidance coming from Canada's top doctor. Previously, Dr. Tam only advised that people showing symptoms of COVID-19 should wear a mask out in public. She says this advice on masks has evolved based on science. So how will wearing masks help as Canada gradually reopens? Dr. Catherine Hankins is co-chair of the federal government's COVID-19 Immunity Task Force. She joins us from Sutton, Quebec. Hi, Dr. Hankins. Good to see you.
Hi there, Vashi.
I have a ton of questions on testing that I'm itching to get to. I just want to first ask you briefly, though, based on your expertise, about the advice around the recommendation now, explicit recommendation that we wear masks when physical distancing isn't possible. Sound advice, the right advice? What do you think?
Oh, I think it's sound advice. Absolutely. It's not so much that it protects you. And so I think people shouldn't feel overly confident in any way with it, but it does protect other people. And I certainly have mine. I think, these are fine. It doesn't have to be any kind of official one, as long as it's got good coverage over your nose and your mouth and it's tight around the bottom here.
When I was looking into it earlier today, I started looking into what countries have issued a recommendation. Like today the news was it went from suggestion to recommendation. There are about 50 countries where it's become mandatory in public spots. What do you think public officials here will have to consider if it ever gets to the point where they are deciding whether or not to make it mandatory in this country?
Well, I think you have to think about, for example, I think in Montreal, they're actually providing them for people that are getting on the metro. So I think you have to think about, you don't want people who just happen not to have one with them to be impeded from using public services. So you have to think ahead. It's something we're all going to have to equip ourselves with, for sure, but it also helps. It's sort of like, when we introduced bicycle helmets, I think there was a program in Quebec where you got a $20 rebate for buying a bicycle helmet, just to encourage people, nudge them in the right direction.
Do you think eventually it will be mandatory in Canada?
I don't know. I think it'll definitely be a social norm. Whether it's mandatory, I think you'll see some stores will want you to wear a mask coming in. So I think it's going to become a social norm pretty fast.
Let me ask you about testing, because the committee, the task force rather, that you head up is tasked with immunity, studying immunity. And key to that will be serological tests. I think it was last week, and I may be wrong because I'm mixing up my news releases sometimes, but I know that the first serological test was approved for use by Health Canada. How significant is that to the work that you're going to be doing?
Oh, it's great news. Actually, there were 2 that were approved, and we're hoping there'll be more in the pipeline because we're going to need more than 1 or 2 for sure. We want to proceed pretty quickly with cross-validation studies. So we're working with the National Public Health Laboratory Network, and we're hoping to be able to get cross-validation of maybe 4 or 5 different assays so we can see how they perform and know what to use going forward for the studies that we want to encourage.
Can I ask you in layman's terms what cross-validation means? Does that mean that you're testing for accuracy?
Yeah, we're looking to see, if you have a known positive you know this person had infection and it's a known positive. When you test it with this assay, does it show that they have antibodies? Does this assay show antibodies? We're looking to see what the test performance is, because we want very good test performance. What we don't want are false positives where it says it's positive and it's not, because you can imagine a situation where that might then lead to a chain of transmission if somebody thought they had antibodies and might potentially have some level of protection. So we want the test performance to be accurate, reliable, repeatable, and consistent.
And how long does it take to be able to ascertain that it is accurate, that it is consistent? How long will will that cross-validation study have to take?
We're hoping to get this done in a matter of weeks, because we really want to get out and start to do some of our top priorities. So the top priorities with a good test would to see what is the penetration of this virus in the general population. What percentage of people actually have been exposed and have some level of antibodies? We don't know if those antibodies are protective or not, and if they are protective, for how long they're protective. But we'd like to know, are we talking about 1%, 2%, 4%? What's the percentage? And then eventually, obviously, we want to be looking at populations that have been at higher risk of exposure. So our healthcare workers, our long-term care workers, people that are living in long-term care, Indigenous communities, other vulnerable populations where a spark can really kick this off. We'd like to know what is the level of potential immunity in these populations.
So on the second half of that equation, the potential immunity side of things, is there work being done or what kind of work is necessary, I guess, to be able to conclude that the antibodies being present means that you are immune, or how long you're immune for? Is that being studied, basically?
Well, that's what we want to study. I mean, the very first thing is to develop and further refine these, what we call neutralization assays. So these are assays that basically look, so you have antibodies, do they actually neutralize the virus? Do we see in the lab that they can beat the virus? Then we want to see people who have antibodies, when they're put back in situations where they may be at higher risk, maybe they return into a healthcare setting and so on, do the antibodies actually protect them? Do they get milder symptoms? Do they get worse symptoms? Do they get no symptoms at all because they are protected? And if so, over time, how long do those antibodies last? Are they staying there a month, 2 months, 6 months? What can we know about the immunity and the protection and the length of it?
Are there other jurisdictions studying those questions, and will your task force be able to draw on any evidence they might have?
We are tracking the literature worldwide, absolutely. I think we've seen various countries using different types of serological tests. I don't think Canada's behind. I think we're right up there trying to move forward. We're doing it in a way that we want it to be absolutely accurate and valuable, and not just some kind of fling-flang testing that you don't know what it means. But we are, in terms of the basic science, the Canadian Institutes of Health Research is moving forward with a number of basic science studies to help us better understand immunity. And as I said, the testing is moving forward quite quickly now with the validation of the tests that have been approved and more that are coming, and a better understanding of what antibodies really mean.
Are there any challenges once you are able to arrive at the end of the cross-validation period and you're able to say, okay, these are accurate? How will it work when it comes to actually testing the number of Canadians that you plan to test? How do you scale up, I guess, is what I mean.
So we're doing it not so much from a public health point of view, but we're doing it from the point of view of knowing where this virus has gone and how many people are actually infected and how many have got antibodies. So for example, if you look at healthcare workers, we would want to be working with researchers across the country that are already starting to think about how they want to design healthcare worker studies so that we can have a common set of variables that get collected, and we can draw some conclusions at a national level about what's going on. So we want to kind of harmonize, encourage, fill the gaps, try to get a better overall picture, more of a bird's eye picture of what's going on in Canada.
I wanted to also ask you before I let you go, Dr. Hankins, about the other side of testing, and that is the diagnostic side of testing. I listened to an exchange with Dr. Tam today that I thought was very interesting because she laid out that there's an average of 28,000 tests, let's say right now, being conducted in the country, diagnostic tests, but the capacity exists for 60,000. And I'm wondering from your point of view, even though you're going to be doing your work on the serological side of things, what kind of capacity do we need to have a better handle on the spread of the virus? Does it need to be far greater than 60,000?
I wouldn't be able to guess that, but I would think let's aim for 60,000 first and get them rolled out to appropriate populations and then see, because, it's a relatively simple test to do. And if we can get the reagents and move forward with it, it can be very, very helpful in determining who ought to actually self-isolate for 2 weeks and not be in contact with other people.
Do you have any idea, or what would your assessment be of why we are unable to hit the capacity that exists? Why we're only halfway there right now?
I think it's not a question of personnel. From what I understand, there are issues like reagents, getting sure that we have enough swabs. Depending, each province may have slightly different reasons that they're not able to scale up as much as they want to. So trying to get over those, I guess you could call them procurement issues, get things moving more quickly would work everywhere.
And on the work that your task force is going to be doing, I just wanted to make sure I have a timeline for our viewers. You were saying that these studies could be done in the next few weeks, and then what happens right after that?
Well, we have already been developing a list of priorities, the top short-term priorities, longer-term priorities. I know the press announcement said that we would do 1 million tests in 2 years. I think that what we're going to try to do is to move as rapidly as we can and be as helpful as we can with the results that we find. So beyond just saying that the cross-validation is going to be done very quickly, I can't tell you when we're going to have sort of the beginning of a result for the whole country.
Are those 1 million tests, do you think that's not accurate, or is that just sort of an early assumption?
I think it's an early assumption. It might be more than that. We don't know yet. We'll have to see how it goes, but we want the test to be useful and to be people to be selected for it carefully and populations selected and studies well designed so that it's not money wasted, of course.
Okay, I'll leave it there. Thank you, Dr. Hankins. Appreciate your time and your insights this evening.
Thank you. Nice to speak to you.
Thank you. Dr. Catherine Hankins is the co-chair of the federal government's COVID-19 Immunity Task Force. You could soon see a lot more people wearing masks. Today, the Chief Public Health Officer, as we were discussing with Dr. Hankins, officially recommended Canadians wear them in public when physical distancing is at risk. Also in Ontario, masks are now recommended for anyone using public transit. Here's Provincial Transport Minister Caroline Mulroney making that announcement.
On the advice of Ontario's Chief Medical Officer of Health, we are recommending anyone traveling on public transit wear a face covering to help stop the spread of COVID-19. However, there are exceptions. Face coverings should not be placed on or used by children under the age of 2. Anyone who has trouble breathing, and anyone who is unable to remove it without assistance.
Many people commuting into Toronto come from the Peel region, where the COVID-19 curve is persistently high. In the last week, about 20% of Ontario's new cases came from that region alone, even though it represents 10% of the province's population. Those numbers have prompted concerns from mayors as Ontario begins to reopen. To join me now to discuss, Patrick Brown is the mayor of Brampton, and Bonnie Crombie is the mayor of Mississauga. Hi to both of you. Thanks very much for making time.
Evening.
Thanks for having us, Vashi.
Good evening. Let me start off with both of you on the question of masks. Mayor Crombie, how do you envision this new recommendation being implemented in your city?
So certainly we have seen, and we have the Public Officer of Health has been proposing for some time, if you are not able to take or keep safe physical distancing, the right thing to do is to wear a mask. Of course, these are issues that we are discussing with union and with management. And then, of course, there are enforcement issues that would have to be considered as well. So it's not that simple. Would you deny someone boarding because they didn't have a mask? Would you have extra masks to provide to them? Should they not have one on their own? So there are lots of considerations in place with respect to the masks. This is very new information, and so of course our staff are still dissecting it all.
Mayor Brown, how do you envision it being implemented in your city?
Yeah, similar to Mayor Crombie, we're looking at that right now. Public health's advice on this has obviously evolved since the beginning of the pandemic. We provided a non-medical mask to our transit operators before we got that advice from public health, and now we're having the conversation whether we should make it mandatory for those using transit. In terms of grocery stores, that would probably be a provincial call, but if it helps public health in an area where we're struggling to flatten the curve, everything's on the table.
When it comes to making it mandatory, Mayor Crombie raised it. I was just talking to a doctor who was discussing it as well, Mayor Brown, that if you do make it mandatory, there comes with that the responsibility to provide for people the masks. Is that something that, we've heard PPE struggles all across the country. Is that a challenge, or do you think that's something you might be able to do?
I think that's a challenge, and there are certainly.
Oh, sorry.
We both right.
Yeah, I'll get. Go ahead, Mayor Crombie, and I'll get Mayor Brown right after you.
You're right. Certainly. So there are certainly supply issues. Do we have enough masks so that everyone who needs one and wants one will have the ability to purchase them? Will we require it? What's the enforcement? With respect to grocery stores, we see that many of the grocery stores, Longo, Walmart, Costco, are all requiring their patrons to wear masks. All of their staff are wearing masks and shields as well. With respect to our drivers, both Mayor Brown and myself have offered our drivers masks voluntarily. We've also provided safe physical distancing by gating off the area where the driver is seated and also eliminating certain rows of seats. And in Mississauga, we've actually offered those plexiglass covers. So as you walk in the front, should we eventually return to fare collection, the drivers will be adequately protected with plexiglass.
Mayor Brown, the same question to you on making it mandatory and what that might mean.
Yeah, in terms of the non-medical masks, I believe we could source them. Part of the challenge is right now municipalities are bleeding revenue on transit. The virus is obviously present in transit. We've had 5 transit operators test positive in Brampton, and I'm sure there's more spread amongst those using it. Having said that, the food sector is dependent on this. Those working in the food supply sector, we have medical laboratories like Dynacare in Brampton that's dependent on transit, and so it's a difficult position where you need transit, but there's a risk to the public for it.
I want to quickly follow up with you before I turn to reopening the economies, Mayor Brown, on the question of, because you said it and it made me remember that I've been asking mayors right across the country. A lot of people have raised the issue of finances for cities, the exact same the way that you did, Mayor. There are conversations, I understand, going on at the provincial level and the federal level. The ask is there. Have you had any assurances from either government that there will be a backstop at the end of the day?
Well, we've had these weekly calls with provincial ministers and federal ministers. They're saying all the right things. They're saying that there's going to be help on the way. But until we see it, it's just a promise.
Mayor Crombie, what about you?
Certainly, they've provided operating revenue, business continuity funding for individuals, for small and large businesses. It's really time for them to turn their attention to municipalities. We need their assistance as well. Many of us are in a strong deficit position. I'm in a $50 million deficit right now, $60 million by the end of June. Certainly, this could be a $100 million proposition for me long term. As Mayor Brown has said, we're bleeding through transit, $7.5 million per month for me. We've also laid off 2,000 people. And I will venture to say that municipalities are the only level of government that actually have laid off people, and we've implemented hiring freeze as well. So we have some serious issues. I know the federal government is looking at it, as Mayor Brown has said. They're looking at, could they fund us directly through the gas tax or a similar sort of measure? We have received no firm commitments from either level of government, although at our last Large Urban Mayor of Ontario meeting, Mayor Brown and I helped move a motion to pass a resolution asking the Premier to put forward the ask to the federal government.
So I'll have to follow up with the Premier then. Mayor Brown, let me switch topics and let's talk about reopening, which of course began in earnest yesterday in Ontario. I understand, actually you both just got off, and correct me if I'm wrong, a daily call with Peel's Chief Medical Officer of Health, Lawrence Loh. Dr. Loh has talked about some concerns around the speed at which this might be happening, given the cases and the spread of the virus in the Peel region. What was his latest information to you, Mayor Brown?
Well, we get our daily briefings not just from Dr. Lawrence Loh, but Michelle Emanuel at Trillium Hospital, Dr. Naveed Mohammed at Brampton Civic and the Osler Health System. These are brilliant medical minds, and they're making their advice based on science and evidence. And I know there's political pressure in some parts of the province that, we need to restart, but I can tell you here in Peel Region, we're taking our advice from medical professionals, and they're not seeing a flattening of the curve that would warrant a reopening. And so, we believe strongly that we need to be cautious and a little bit more slow in terms of how we reopen. I don't want to see a second wave, and I trust these physicians.
Are you worried, Mayor Crombie, that things are going too fast?
Oh, absolutely. I don't think we're through the first wave yet. I think the number of new case studies don't support a reopening yet. We've had 226 new cases in Peel in the past 72 hours. We want to take our time. We want to base our decisions, as Mayor Brown has said, on empirical evidence, on the data. And we don't see the declining numbers yet. In the very beginning, we were given 4 indices that we had to meet before we could reopen the economy. The number one was a 14-day rolling period of declining cases. We haven't seen it in the region of Peel. There are certain parts of Toronto that haven't seen it either. That said, there are areas right across the provinces that are seeing declining numbers. I know for a fact that Kingston prides itself on being COVID-free. We're looking at testing. Can we do adequate testing? Today on the call, our representatives from Trillium Health Partners have told us that they have tested now 21,800 people. That was an increase of 608 overnight. So that's a large number of people, but it is not enough. Do we have the capacity in our hospitals? Michelle D'Emmanuel has told us we're at 85 to 89% capacity in our hospitals, so it doesn't exist yet. And finally, are we able to track and to trace? And we're not quite there yet either. And on the other side of the coin, we need the Premier to give us a heads up so that we can adequately prepare. Once he announces that there will be a reopening, for instance, golf courses, people are getting their clubs out and getting ready to go golfing the next day. And unfortunately, it doesn't work that way. It took us a few weeks to shut down all our facilities. It takes us a bit of time to get them prepped. We've laid off all the staff, bring them in, proper education, proper sanitation, hygiene, etc. Signage is required. So there's a lot more thought going into the reopening than the municipalities haven't been given. They haven't been given the adequate heads up for yet, Vashi.
Do you agree with that, Mayor Brown? Do you want more heads up, I guess, when the next phase is being entered? And is there anything that you can do if you are concerned about the speed at which this is happening to slow it down, given that so much of it is provincial jurisdiction?
Well, the more notice, the better in terms of being able to adapt. But what I would say, what is in our control, where other communities are opening team sports facilities like baseball or basketball, we're not doing that locally. But in terms of the provincial entities like private golf courses that have been opened or retail stores, it very much depends on that provincial direction. And it does cause me worry when we have our medical officer of health and the leadership at our 2 hospitals who are worried about the pace of the reopening. And, I'm not a physician. I have to depend on the advice of these leading physicians. And when they're concerned, I'm concerned.
Okay, I have to leave it there. I'm out of time. But thank you very much for your time tonight. I appreciate it.
Thank you.
Our pleasure.
Thanks to Mayors Bonnie Crombie and Patrick Brown. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.